timing of when young patients should switch from seeing a pediatrician to an adult doctor is a decision most families face at some point as their children are growing up and seeking more independence. And there's no one answer to fit every family. But in today's Health Break, we take a look at some of the factors that you should consider when choosing who will treat your child.
With college campuses full again, some of the newest students face a new decision. The first time they don't feel well in their independent life.
You know, you're transitioning into college. You're making, in some circumstances, you can be by yourself in a dorm. You know, maybe adulthood starts there.
And so might being treated by an adult primary care physician. Pediatricians can see patients until they reach the age of 21. But some young people choose to switch to an adult doctor sooner as they experience other changes.
Some patients at about 17 or 18 are tired of coming to the kid-friendly office and hearing babies in the background and choose to transition earlier.
Usually the child, the adolescent, you know, feels more grown up. They just want to be in a more adult environment, or they have things that they feel are more grown up, you know, complaints or things they want to discuss with the doctor that they don't feel comfortable talking to about with their previous pediatricians. So, you know, some patients prefer to have a new person kind of involved to discuss things like that.
Like any healthcare decision, switching from a pediatrician to an adult primary care physician is personal. And it's a case when doctors' orders become suggestions.
I do recommend that they stay until 21. I do think that there are a lot of things that we can offer, and I do think that many of them, now there are some folks that are ready very, very early, very old souls, but many of them are not quite ready to do all of that independent medical decision making yet. Yes, you're an adult, but you're not an adulty adult, and so you still need a little bit of hand-holding and guidance about things like nutrition or navigating college or navigating vaccinations like yearly flu shots and things like that. And typically we know them. I mean, you know, if you're a patient with chronic conditions, who knows you better than the doctor that's seen you since birth?
Dr. Riegner's son Mason is 20 and still sees his pediatrician, but he says that probably makes him unique among people his age.
I have a lot of friends that go to the clinic on their campus. So it's a lot more affordable, and I guess they can count as an adult doctor. I think it really just depends on preference, but you have to do it by 21, so I would suspect probably around when you graduate high school, which would be around 18.
The patient-pediatrician relationship is so close that it can be a factor in switching to an adult doctor.
So there is the comfort. You know, I've known you my whole life, Dr. Riegner, so I feel comfortable enough to talk to you about my emotions or some of my high-risk behaviors, and I do ask high-risk behavior questions, but sometimes they might not be as honest with me. When they move on to an adult doctor, I do think there might be a sense of, hey, my parents have no connection here, so maybe I can be more free to speak. I'd like to think that they feel comfortable with me too, but I understand if sometimes they need to move on and talk about adult things with adult people.
But after what is often a lifetime of care, Dr. Riegner never feels as if she is losing a patient who decides to switch before 21.
And then when the time comes, I see their kids. I have lots of grand patients now that I've been practicing for this long.